Hi, my name is Jenny Schroeder. I'm a family nurse practitioner student at Maryville University. This is my physical assessment for my advanced health assessment class. My patient's initials are JS to protect his privacy. The first thing that I'm going to do when I enter the room, I'm going to make sure that my patient has emptied his bladder and he also has a gown on, which he has already done. I'm visualizing his vital signs, his BMI, his height, his weight, seeing how his near and far vision is when it was tested on the Snellen chart prior to coming to the exam room. The next thing I'm going to do, I'm going to go ahead and assess his head and face. I'm looking at his skin, I'm looking at the symmetry of his facial features. I'm making sure there's no lesions or sores or any discolorations or any abnormalities that I'm first seeing. Next, I'm looking at his hair. It's thin, it's fine, it's appropriate for ethnicity and for his age. Next, I'm going to go ahead and palpate that scalp area to see if there's any kind of deformities or any kind of pain, crepitus, and there is nothing of that nature. Next, I'm looking at his eyebrows. They're nice and thick and bushy along with his eyelashes that are protecting his eyes, his very white scleras. The next thing I'm looking at is his conjunctiva. I want to go ahead and a pen light, just take a peek because the lighting in here is not too good. And it's nice, pink, and moist. And I'm going to go ahead and palpate on that area for any abnormalities, and I don't see any whatsoever. I'm going to test his pupillary response, direct. I'm going to do his indirect. And yes, and the opposite pupil respond to the light on that side. We're also going to perform the cover uncover test. Sir, if you'll go ahead and cover one of your eyes, and I'm looking for nystagmus and I don't see it, go ahead and uncover it. Next test, and I don't see it as well. I want you to go ahead and follow my pen, please, and don't move your head when I'm doing it. And this is for the cardinal gaze. And you passed that very well. Wonderful. Next, I want to go ahead and palpate his maxillary sinuses because they're all kind of around in this area here. I'm trying to feel some tenderness, edema, swelling. And once again, I don't feel anything like that. Since I am palpating, I'm going to go ahead and feel his temporomandibular joint. Go ahead and open up your mouth for me. Close it. I don't feel any popping or cracking. And it's good alignment. What I'm looking at now are his ears. They're symmetrical. They're in the correct location. I'm not seeing any lesions or sores, abscesses, or drainage in any of them. I'm going to go ahead and palpate that auricle in here. And I don't see anything. I'm going to take my pen light again. That looks good. Still nice and clean. We're going to do a couple different hearing tests. The first one being the Weber, and this is with my tuning fork. Sir, when I strike this, it's going to make a ringing noise. I need to know if you hear it in one ear, both ears, or not at all. Okay? Do you think you can help me out with that? Get one more strike.
I hear it in both ears.
Okay, great. Now the next test is going to require me to set a timer. So please just tell me when you don't hear this anymore. Are you able to move over just a little bit? Great. I can place this down. I'm missing that. Okay.
Okay.
Okay. And that was exactly double the amount of time. which it should be. Air conduction typically gives you a double amount. So the first time was for 12 seconds and the second one was for 24. So that's very good. Next, I want to go ahead and look inside of your mouth. First, I'm going to look on the outside of your lips. And I just see that great color, shape, symmetrical. Don't see any lesions or abscesses. Go ahead and open up for me. And what I'm doing in here is I'm looking around, I'm assessing his palate, his dentation, the color, and form of his teeth. It looks like there's approximately 32 adult teeth. His palate is clean. Go ahead and lift your tongue up for me, sir. Good job. It's blue in color. I don't see any lesions, any cancerous. Go ahead and stick your tongue out for me. Go ahead and put it back in. That makes it a little bit better. Okay, I want to do a sensory test, so please just tell me if you're able to feel this. Close your eyes.
Yep.
Keep your eyes closed.
Mm-hmm.
Perfect. And I'm looking here at your nose, and it's symmetrical. You have a little color discoloration in here from sun damage. Your turbans are also equal. Your septum is nice and straight. And let's go ahead and do a nice sniff for me. Good. Do another one. Excellent. The next thing I'm going to do is go ahead and assess your neck in this area. I'm looking for any abnormalities. Do I see a tracheal deviation that's really pronounced? Do I see any JVD? Do I see any skin lesions? Do I see any abscesses? Once again, just seeing a little bit more of sun damage, which is pretty typical here in Florida. But I don't see any areas of concern in this regard. Next thing I'm doing is I'm palpating that trachea to make sure it's not something more than I don't realize. I'm able to assess his Adam's apple and his cartilage, and this is so that I'm able to find his thyroid when it comes time to assess that. And sir, where did your glass of water go? I do not see it.
It's on the table over there.
Okay. Now I'm going to go ahead and assess this your thyroid. So go ahead and take a nice big sip for me, big swallow. Okay. One more time. Okay, good job. I'll go ahead and assess his carotid pulse. And you don't want to do this at both times because then your patient may lose consciousness on you. Strong, equal, and reactive. And I was just looking at the rate and the rhythm. Next, I'm going to go ahead and see, auscultate if there's any bruise where they shouldn't be. This will be the thyroid as well. Go ahead and assess all in here. Periauricle, post-auricle lymph nodes, mandibular, postmental, occipital, clavicle, clavicular chain, the deep, and I'm not feeling anything. Any large dissension, no striking or painful stimuli with that. Next, I'm going to be assessing chest, lungs, and heart, which is a very large portion of this young gentleman's body. So it is, it's really important for me to look to make sure that there's symmetry in his respirations and the size from the front to the back. I'm not noting a barrel chest or a pigeon chest. I'm able to appreciate where his bone structure is through this gown. I'm also going to be percussing in a systematic movement, just to see if there's any hyperresonance or crepitus or any areas that shouldn't be flat that are. And I'm just going to be assessing each side. In this area, I'm really trying to look for any thrills, pulsation, pericordium area. And this gown's tied a little bit too tight. There we go. And as I'm looking at his hair and his skin, a lot of pouching, very appropriate for his age, ethnicity. And I didn't see anything of that nature. Now I'm going to go ahead and also take his lung sounds first, and then I'm going to also take his heart sounds. Trying to find his apexes, like the size of my whole body. Take a nice big deep breath. Let it out. Nice big deep breath. 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 Okay. Now with his heart sounds, going for the aortic, just listening for the S1, S2, pulmonic, tricuspid, mitral, apical, I'm going to go ahead and have JS turn onto his backside so that I'm able to percuss and oscillate his rear. I'll help keep this up. Once again, just visualizing some small moles, some hair, very typical in his age group. Little cyst that he's under care for by a dermatologist. Now I'm going to go ahead and percuss in a very systematic approach. Here we go. gonna look for tactile comitis. Okay, Jamie, go ahead and say, oh, sit back up for me. Say 99.
99, 99, 99, 99, 99, 99, 99, 99, 99.
Let's see how his lung expansion is. And what I'm trying to do is just see how much of this expands. I don't want one side to go up more than the other. Take a nice big deep breath. Let it out. Go ahead and arch your back for me. And do that again, please. I'm going to go ahead and get onto this other side. We're going to assess his kidneys. There we go. Any pain?
Yeah.
Great. Now on this breathing test, I want you to go ahead and take a nice big deep breath in and then hold it. Okay? And let it out. I'm going to go ahead and mark that area. Now, with this one, I want you to take a nice big deep breath in and then blow it all out, okay? Okay. Perfect. And this is between the 3 and 5 centimeters allowed for his expiration test. Wonderful. I'm going to go ahead and get on your other side. You want to go ahead and turn around for me, or whatever's easy for you to go ahead and get onto the couch. And go ahead and place your head where those pillows are. That way I'm able to assess your hip and spleen a little bit better this time. Oh, I think I'm going to have to turn this just a little bit. Thing that I'm doing, I'm visualizing his abdomen. And what I'm looking for is any pulsations, changes in color, anything of any nature, any kind of heating, especially around the aorta. Okay, and I don't see anything like that. The next thing I'm going to do is assess his vowel sounds in all 4 quadrants. Before I start palpating. Right upper, left upper, right lower, left lower. And they all sound very, very good. I'm going to go ahead and assess his liver, and I'm going to do that through palpation. Jamie's almost 6'5", and he's a larger gentleman, so, and also with his age of 42, I would suspect that his liver is going to be of a greater size. So mid-clavicular. on the large side, 4.5, I'm thinking, with the liver size, but with his presentation, that would make a lot of sense. Okay, the next one, I'm assessing his spleen for dullness. And the spleen is difficult to assess, especially if you have a gentleman with a full belly, full bowels. What I can do is have him roll over. You can go ahead and roll over to my side. Maybe I'll be able to palpate that. Typically, you don't palpate that. Yeah, I'm not able to feel that. I'm trying to. Okay, go ahead and roll back over on your back. I'm going to do some soft palpation and then some deeper palpation. That's just really to appreciate all the organs. This shouldn't be bothersome at all. If it is, please let me know. This is going to be a little bit deeper. Definitely feel that liver now better. Not able to still appreciate the spleen. And while I'm here, I'm also go ahead and assess the aortic. See if there's any bruits. There's none, which is good. Right renal, left renal. The iliac, the femoral, I don't hear any bruits, which is an expected finding.
Back on the bench.
Yes, I love it if you get back on the bench, sir. And hopefully, there's not too much movement. There we go. Next, let's go ahead and judge your strength, your reflexes, and your pulses. Okay? First thing I'm going to do is assess your brachial pulse. Good and strong. Good and strong. And strong again. Popliteal. Popliteal again. That's good. Go ahead and raise your hands up and push against me. Raise your hands down. Good. Same with your feet. Good job. I'm looking for my reflex hammer. There it is. Just relax your arm. Good job. I can do that one. Good job. Go ahead and relax that one a little bit better. Excellent. Okay. Let's go ahead and check your knees. Pulses. Good job. I'm going to do some of your cranial nerve tests. If you can go ahead and squeeze your eyes as tight as you possibly can. Lift them up as high as you can. Great. Wrinkle in your forehead. Smile. Push your teeth and grind them into each other. Excellent. Stick your tongue out. Open your mouth and say ah.
Ah.
Beautiful. One of the assessments that I inadvertently left out, I would like to listen to the lateral portion of your lungs. Would that be okay? And that way I can compare them. Are you able to hold your arms out for me? First thing I'm going to do is go ahead and percuss. There we go. Let's redo that side. Now I'm going to go ahead and breathe. Nice big deep breath. Do it again. While I have your arms up, I'm going to assess axillary lymph nodes, and I don't feel anything of concern in that area. What I would like you to do is go ahead and stand up, please. And bend over and let me take a look at your spine and make sure that it's symmetrical, which it is. No scoliosis or curvature in the spine. Well, that's the completion of my assessment. I hope everybody enjoys. Thank you.